Hey guys, welcome back to my channel. Today we'll do a quick revision on SLE. Okay, so SLEs are connective tissue disorders. So in connective tissue disorders, there are two types: immune complex mediated and inherited. So immune complex mediated is SLE. Okay, so generally the SLE incidence is 1 in 500. Okay. Basically SLE has a collagen damage and females have 90% of these immune mediated collagen connective tissue disorders because females have fetal microchimerism because fetal tissues, fetal cells will act as anti foreign cells in which mother will produce always different antibodies. So mother is always like very more sensitive compared to males. Okay. Coming to hormonal changes in actually estrogen, what is that is the cell response, cell mediated immunity will become type 2 of cell mediated immunity is increased in estrogen, and progesterone decreases the immune system, immune complexes. So that's why the females are more prone as the estrogen progesterones are more in pregnancy, they're more prone to SLE. There are some SLE genes. Remember Apollo Hospital as STAT. Okay, so SLE genes are APOL1, STAT4. Okay, not only that, we also know that SLE has one antibodies like anti-dsDNA, right? So that way DNA is one. Okay, so one. So DNA is one, then HLA, DR3. Okay, these are the different genes which are involved in SLE. These are located on chromosome number 16. Okay, so what are different antibodies involved? ANA antibodies, okay, anti-DS DNA antibodies, anti-Smith antibodies is specific one, anti-Rho, anti-La, it is associated with heart disease and also the skin lesions, okay, and also the Sika syndrome is seen with the anti-Rho and anti-La, okay. Anti-RNP is also specific antibody. Anti-histone antibodies is there. Okay, anti-histamine antibodies are generally seen with drugs, any immunotherapy, any radiotherapy or any other drugs which are being used, which causes SLE. Okay, now coming to if a person came with SLE, what you'll do? You'll do pre-pregnancy counseling because pregnancy aggravates SLE. So that's why we'll do a pre-pregnancy counseling, what to do, what are the different drugs need to take, how many. Once the flare-ups are settled, then she can go for a pregnancy after 6 months. Okay, Foxy says that if she became pregnant, now Foxy says that you'll do CBC and all, urine routine and all. Along with that, in the first visit only, you'll do glomerular filtration rate, and also you do protein to creatinine ratio. This is done in each trimester. Each trimester means each 3 months. If the symptoms are very severe, then each monthly you'll do this. Okay, only the C3, C4, and CH50 is done in each trimester, and monthly you'll do platelet count. No, anytime you heard that a pregnant female having monthly platelet count done, it is an SLA. Okay, so there is flare up. What you'll do? You'll start prednisolone, that is 1 to 2 milligram per kg body weight. So 2 milligram per kg for 50 kg weight month. So 100 milligram per day she is taking. Slowly we'll taper it to 10 to 15 milligram per day. Okay, so what are the different symptoms you see? Okay, so she'll feel fatigue. She'll feel fatigue. She'll have joint pains. She'll have that sun sensitivity, photosensitivity. She have serositis, joint pains. Okay, and systemic symptoms, you have that pleuropericarditis, you have anemia, you have renal complications. Okay, so what are the different 11 symptoms of SLE, in which four, if you have, that is known as SLE. Okay, first thing is that skin one. Okay, skin sensitivity is seen. Then you have oral ulcers. Then you have serositis. Okay, serositis. Then you have joint pains. Then you have alopecia. Okay, and all the cells are involved, like thrombocytopenia, leukopenia, lymphopenia, and um, even the, I think, anemia, right? Okay. So lymphocytopenia, leukopenia, thrombocytopenia, anemia. Okay. Brain is involved. Kidneys are involved. Brain is involved. So neuropsychiatric symptoms are same. Kidneys are involved. So you have that protein to creatinine ratio elevated and lupus nephritis is seen. So in these 11 symptoms, if four are present, it is known as SLE. Okay, how to screen? ANA is a best one, but it is a non-specific screening. Then you can go for apply antibodies. Not only that, you can go for hypocomplements and direct home test. These are screenings. See, generally you do antibodies, but these are screenings. These are screenings. Okay, so ANA, APLA, hypocomplementemia, and direct home test positive. In SLE, there is 1 is to 900 live births, and mothers dying because of SLD in pregnancy is 325 in 1 lakh. Okay, what are the drugs you'll give? Hydrochloroquine, okay, cyclosporin, azothioprine, then tacrolimus. Azothioprine is 2 milligram per kg body weight, and steroids also given. So total five drugs, okay? Hydrochloroquine, cyclosporin, azothioprine, tacrolimus, and steroids. These are safe in pregnancy. Very important. Remember this thing. Uh, this C is cyclosporin. It is not cyclophosphamide. Okay, cyclophosphamide is contraindicated. Even we can give IVIG. Okay. So, what are the different things which are contraindicated? Cyclophosphamide, even methotrexate is contraindicated, and mycophenolate mofetil is contraindicated. If a lady, pregnant lady, is having SLE, then you should go for fetal 2D echo at 18 to 26 weeks. Okay, because there is heart blocks. So that is known as neonatal lupus. In neonatal lupus, you have heart blocks, you have kidney diseases, and also the skin problems. Almost 60% neonates have skin problems. Okay, even platelets are decreased in the small babies. For this, mother should get HCQ and steroid treatment. Steroids are 12 milligram per kg body weight. Yeah, sorry, 12 milligram in a week you'll give. Okay. Then treatment. If the neonate have the heart block, what you'll do? One third will be dying, stillbirth. One third will be dead in the uterus only. And pacemaker. If they are born live, then you can go for pacemaker. Okay. If a mother with SL is dying, it is because of renal failure. Okay. Contraception, if you want to give, then you should not give the combined oral contraceptive pills. Okay. This is about SLE. Now I'll tell you about ULAR updates. ULAR is the one which actually gave some criteria for SLE. So these are ULAR updates for SLE. Okay. So what is that? In 2019 they gave some updates. So first thing is there's a new drug known as Aniflo, Anifrolumab. Okay, it is an interferon 1 receptor antibodies. Voclosporin, it is a cyclosporin kind of thing. It's the anti-beta cell agent. Okay, voclosporin is a cyclosporin one, and anti-beta cell agents are also being given, like rituximab, belimumab. Rituximab is CD20, belimumab is anti-BAF antibodies. Okay, so these are four new drugs being given. Apart from all this, we can give these also. So anifrolumab and voclosporin, rituximab, and belimumab. Okay, principles of this ULAR update is you should work on multidisciplinary team like dermatologist, pediatrician, neonatologist, cardiologist. These all nephrologists should be involved. Okay, SLEDI score is involved. Like if it is less than zero, it is zero. It is normal. Non-pharmacological methods being used like sun protection, sunscreens, dieting, weight loss. Okay, lifestyle changes, no smoking. These should be done. Drugs like which I already told. These things. Okay, hydrochloroquine and cyclosporin you can give. Early diagnosis is very important. So what are the drugs? Is hydrochloroquine. Hydrochloroquine is given 5 milligram per kg body weight. We can go for chloroquine and quinine. Glucocorticoids can be added. Anti-proliferative lupus. If anti-proliferative lupus is there, then you can go for low dose cyclosporin and glucocorticoids. Or in this, the new drug like this, voclosporin can be added. In which what? In lupus nephritis, we can add voclosporin. Okay. Then if there is SLE and apply, you can add low dose aspirin. Okay, these much points if you remember and you write in your exam, pakka you'll get good marks. 10 marks question you easily get 7.5. Okay, that's it. Thank you.